Let's jump right in. Welcome to this explainer breaking down the 2026 remote patient monitoring updates. Now, if you're watching this, you already know RPM is a total cornerstone of modern chronic disease management. But here's the thing. Understanding the nuances of the 2026 RPM CPT codes, it's not optional anymore. It's literally the key to keeping your practice financially sustainable while giving your patients top-tier care. Medicare's physician fee schedule just dropped some major updates. We're talking fresh opportunities, but also a few tricky new challenges. So let's unpack these changes and get your practice dialed in for 2026. Okay, let's anchor on this massive number, $120,000. That is the potential annual recurring revenue your practice could generate with just 100 Medicare RPM patients, just by using the standard billing codes. Think about that. That's a serious boost to your revenue cycle, all from keeping a close, data-driven eye on your patients outside the clinic. But to actually capture that revenue and not leave it on the table, you've got to know exactly how these new 2026 rules operate. Here's our quick roadmap for today. First, the 2026 RPM opportunity. Second, device setup and supply. Third, care management time codes. Fourth, strict compliance requirements. Fifth, streamlining with RE.DOCTOR. And finally, 4 steps to billing. All right, Section 1. The 2026 RPM opportunity. So, the core driver here is that Medicare heavily backs successful RPM programs. Medicare Part B actually reimburses 80% of the cost for these services, and secondary insurance usually picks up the rest. Basically, you're being financially supported to improve chronic disease management. Sounds great, right? Well, here's the catch. Billing errors are incredibly common. Denials happen all the time because practices misinterpret the 16-day rule, mix up the new 2026 codes, or just fail to track clinical time right. If you don't nail down the exact time requirements, that revenue dream quickly turns into a total administrative nightmare. Moving on to Section 2, device setup and supply. Let's look at the actual codes. First up is CPT 99453. This is your go-to device setup code. You'll use this for the initial technical setup and, the time spent educating your patient on how to actually use the device. But here's the absolute critical rule. It is billed once per device, per patient, per month. No exceptions. If your patient needs a second device in that exact same month, sorry, you can't bill this setup code again until the next calendar month. Now, look at the stark contrast between these two codes. This is where the 2026 RPM CPT codes really shake things up. On one side, we have the brand new CPT 99445. You bill this if a patient transmits data for at least 2 days, but fewer than 16 days in a 30-day period. This officially replaces that old 2-day rule from the public health emergency era. On the flip side is your standard data supply code, CPT 99454, which strictly requires 16 or more days of transmission. And listen closely, these two codes are mutually exclusive. You absolutely cannot bill both in the same 30-day window. It's an either-or situation based on the patient's actual device usage. Next up, Section 3, Care Management Time Codes. This brings us to another huge 2026 update. We finally have a light touch code. CPT 99470 is brand new for 2026, and it's built specifically for those patients who just require minimal intervention. You hit just 10 minutes of clinical time in a calendar month, and you can bill this. Contrast that with our standard care management code, CPT 99457, which still requires a full 20 minutes of interactive communication and data review. Just like the supply codes we just talked about, CPT 99470 and 99457 cannot be billed in the same month. You really have to monitor your clinical time and pick the one code that matches what your team actually did. But wait, what if your patient needs more intensive intervention? What if 20 minutes just doesn't cut it? That's exactly where CPT 99458 comes into play. This is your add-on code. It covers additional 20-minute increments of care management. And the real beauty of this code? You can bill it multiple times per month as needed. You just have to make absolutely sure those initial 20 minutes for the standard care management code were already met and fully documented first. All right, Section 4, strict compliance requirements. Okay, you'll want to pay close attention to this compliance checklist because missing even a single item here can and will trigger a denial. First up, your patient has to have Medicare Part B and an acute or chronic condition, things like hypertension, diabetes, COPD, or heart failure. Second, written patient consent is non-negotiable before you start services. Third, the devices themselves absolutely must be FDA-cleared medical devices that transmit data automatically and digitally. So if your patient is manually typing in their own data, that's generally not permitted for billing. Fourth, all that data has to sit in a HIPAA-compliant platform so you're totally audit-ready. And finally, the whole shebang has to be directed by a billing provider with a valid NPI, like a physician, NP, or PA. Clinical staff can do the heavy lifting of daily monitoring, but it must fall under the general supervision of that NPI provider. Moving right along to Section 5, Streamlining with RE.DOCTOR. Honestly, managing all these mutually exclusive codes and strict logs manually is just a massive headache. This is where a platform like RE.DOCTOR is a total game changer. Their system completely automates the tracking of device usage days and clinical time, so it calculates for you, in real time, whether you hit that 16-day threshold for standard supply or the 20-minute threshold for standard care. It totally removes the manual math and the human error risk, plus it gives you comprehensive ironclad audit trails for every single transmission and interaction. It literally keeps you permanently audit-ready. On top of all that, they use these amazing pocket-sized FDA-cleared digital biomarkers that integrate seamlessly right into your existing EHR. Basically, it lets you focus on actual patient care while the software handles the brutal technical complexities of Medicare billing. Which brings us to our final section, 4 steps to billing. To successfully execute your RPM billing in 2026, just follow this foolproof 4-step process. Step 1, verify your thresholds. Ask yourself, did they hit 2 days or 16 days? Did the clinical time reach 10 minutes or 20 minutes? Step 2, ensure your care coordination software has captured a full, bulletproof audit trail of all automated data and interactions. Step 3, submit your claims on a calendar month basis. This perfectly aligns with Medicare's 2026 reporting preferences. And finally, step 4, cross-check those codes. Make absolutely sure you aren't overlapping with conflicting codes like remote therapeutic monitoring or home health codes for the exact same period. And that brings us to the most important question of the day. Take a hard look at your current setup and ask yourself, is your practice fully maximizing this 2026 opportunity? Are you really capitalizing on the new light touch and short-term codes? Or are you still bogged down in risky manual tracking? If you're relying on guesswork to figure out if you've hit 16 days or 20 minutes, you are absolutely leaving money on the table. So, what is holding you back from upgrading your RPM program today? It might just be time to visit RE.DOCTOR and transform how you deliver care. Thanks for joining me for this explainer, and here's to a highly profitable and patient-focused 2026.